Hi, good evening. Today I'm going to be talking to you about breastfeeding. Do you know that breastfeeding plays an important role in the infant's health and development? Breastfeeding confers extensive and well-established benefits and is recognized as an extremely effective preventative health measure for both mothers and babies, as stated by the Baby Friendly Initiative. Breastfeeding techniques should always be done properly in order to avoid any disease or possible infections. Although breastfeeding sounds like an easy task, expecting mothers should be educated properly on the proper way to breastfeed their infant, as well as the benefits and disadvantages that breastfeeding offers to a mother and a baby. First, I will talk to you about the proper techniques needed for breastfeeding. Next, I will talk about the risks of breastfeeding. Finally, I will discuss the benefits of breastfeeding to mothers and babies. To begin with, expecting mothers should know the proper way to position and unlatch the infant. Here's a graphic showing the correct latching technique. Positioning an infant while breastfeeding is very important. The role of the proper breastfeeding states the nipple should be centered in the baby's wide open mouth. Check that the baby's nose and chin touches the mom's breast. And also, you need to check that the baby's lower lip, it's not folded in. You should feel a pulling and tugging sensation after the initial latch. If the latch is still painful after 1 minute, take the baby off by breaking the suction. There are many options for mothers to position their infants, as shown here. The three most commonly used positions for breastfeeding are the cradle position, the football position, and the laid down position. Unlatching the infant is also very important when it comes to breastfeeding. If the infant is not properly released from the mother's breast, she can develop a sore breast. As stated in the article, the role of the proper breastfeeding: to break the suction, place your finger between the baby's mouth and your breast. Pulling the baby off without first breaking suction may cause your nipple to become sore. When reattaching the baby, mothers should make sure the jaw of the infant is moving with a rhythm. In addition to, expecting mothers should also know the risk they are running when they decide not to breastfeed their infant and the infection they can receive if breastfeeding is not done properly. The American Academy of Pediatrics section on breastfeeding states, unfortunately, only 22% of U.S. women currently adhere to the infant feeding recommendations. Mothers who decide not to breastfeed not only run a risk for their health, but also their infant's health. The National Institute of Health explains that infants not being breastfed is associated with an increased incidence of infections morbidity, as well as elevated risk of childhood obesity, type 1 and type 2 diabetes, leukemia, and sudden infant death syndrome. The National Institute of Health also states that for mothers, failure to breastfeed is associated with an increased incidence of premenopausal breast cancer, ovarian cancer, retained gestational weight gain, type 2 diabetes, myocardial infarction, and metabolic syndromes. Many mothers develop an infection in their breasts because their breasts are not being emptied completely. There are a few simple things that mothers need to remember to avoid the risk of an infection. According to the Mayo Clinic, if a breast doesn't completely empty at feeding, one of your milk ducts can become clogged. The blockage causes milk to back up, leading to a breast infection. Mastitis, as shown in this picture, is one of the most commonly seen infections in mothers while breastfeeding. As stated by the Mayo Clinic, mastitis is an infection of the breast tissue that sometimes involves an infection. The inflammation results in the breast to be painful, swelling, warm, and redness. You might also have fever and chills. Lastly, mothers should be aware of the benefit of breastfeeding for them and their infants. Breastfeeding is very beneficial to the mothers. Not only can they provide nutrients to their infant, but they can also shed baby weight, and they lower the chances of developing a disease. An article titled Mysteries of Milk explained that women who breastfeed have lower chances of developing type 2 diabetes later in life, obesity, and cardiovascular disease, as well as reduced likelihood of postnatal depression. While breastfeeding helps reduce the risk of developing a disease in mothers, breastfeeding can also reduce the risk of developing a disease in infants. The Pediatric Child Health states that human milk feeding decreases the incidence of multiple infection diseases in infancy, including bacterial meningitis, bacteremia, diarrhea, respiratory tract infections, otitis media, and urinary tract infections. The Pediatric Child Health Journal also explains that it contains the live cellular components, immunoreactive substance, and hormones, and other nutritional components needed for optimal growth, health, and development in the newborn. Breast milk is both physiologically normal and the ideal nutrition for the human infant. In conclusion, breastfeeding is a very simple task that benefits mothers and infants, but it can also bring many risks if techniques are not done correctly. Today, we talk about breastfeeding. We first talk about proper techniques of breastfeeding and effective latching. Then we spoke about the risk mothers take when they decide not to breastfeed their infant and the infection a mother can develop from the improper use of techniques when breastfeeding. Lastly, we talk about the benefit of breastfeeding to the mother and baby. Thank you. Have a good night.